What I'm about to tell you is one of the darkest secrets in modern military history. A secret that was buried, denied, and nearly forgotten. A secret that destroyed hundreds of lives in the name of national security and moral purity. This is the story of the Aversion Project. Deep in the heart of apartheid South Africa, during the 1970s and 1980s, something unthinkable was happening behind closed doors at military hospitals. Young men and women, mostly in their late teens and early 20s, were being subjected to experiments. Torture masquerading as treatment. Brutality disguised as therapy. And the South African Defense Force knew about it, sanctioned it, paid for it. But I'm getting ahead of myself. To understand how this happened, we need to go back. Back to a country at war with itself, and a military machine that would stop at nothing to maintain control. South Africa in the 1970s was a pressure cooker ready to explode. The apartheid government, that system of institutionalized racial segregation and discrimination, was facing growing resistance both internally and internationally. The country was isolated, sanctioned, and increasingly desperate to maintain white minority rule. The South African Defense Force, the SADF, wasn't just fighting external enemies. They were fighting what they called the total onslaught, a conspiracy theory that imagined communists, activists, and anyone who threatened the apartheid state as part of a coordinated attack on South African society. And in their minds, this threat came from everywhere, including from within their own ranks. You see, the SADF had a problem. Or rather, what they perceived as a problem: homosexuality. In a military culture built on hyper-masculine ideals, conservative Christian values, and rigid control, the existence of gay and lesbian soldiers was seen as more than just a moral failing. It was seen as a security risk, a weakness that could be exploited, a cancer that needed to be cut out. Under South African law at the time, homosexuality was illegal. The infamous Immorality Act criminalized same-sex relationships. But the military went further, much further. They decided that homosexuality could be cured, that it must be cured, and they found doctors willing to try. Enter the military psychiatrists, men with medical degrees and white coats who would become architects of systematic abuse. The most notorious among them was Colonel Aubrey Levin, a man who would later be called Dr. Shock by his victims. These weren't rogue actors operating in secret. This was official military policy, conducted at military hospitals, with military funding and military approval. The process usually began the same way. A young conscript, mandatory military service was required for all white males in South Africa, would be identified as potentially homosexual. Maybe they were reported by a fellow soldier. Maybe they confided in someone they thought they could trust. Maybe they were simply suspected based on how they spoke, walked, or who they spent time with. Once identified, they were given a choice, except it wasn't really a choice at all. They could face a military tribunal, which would likely result in a dishonorable discharge, criminal prosecution, and imprisonment. In apartheid South Africa, being gay and being branded as such publicly could destroy your life, endanger your family, and leave you completely ostracized. Or they could submit to treatment at military psychiatric units. Treatment that promised to cure them, to make them normal, to fix what the military said was broken. Most chose treatment. How could they not? What happened next is almost too horrifying to describe. But it needs to be told. The victims need their stories heard. The treatment protocols varied, but they followed a common theme, drawn from discredited behavioral psychology theories that should have been abandoned decades earlier. Aversion therapy, they called it. The idea was simple and barbaric. Associate homosexual thoughts and feelings with pain, fear, and revulsion until the patient learned to suppress or eliminate those feelings. Some victims were subjected to chemical aversion therapy. They would be shown images of people they found attractive, same-sex individuals, while being injected with drugs that induced severe nausea and vomiting. Hour after hour, session after session, until their bodies learned to associate attraction with being violently ill. Others endured electroshock aversion therapy. Electrodes attached to their bodies, particularly to their arms and legs, sometimes to their genitals. Then they would be shown images or told to imagine homosexual scenarios, and every time they showed any sign of arousal or positive response, they would be shocked. Painful, repeated electrical shocks designed to condition them like laboratory animals. The sessions could last hours. They happened multiple times a week, sometimes daily. The psychological torture was compounded by physical pain, humiliation, and the complete helplessness of being strapped to a chair or bed while people in white coats inflicted suffering in the name of healing. But it gets worse. So much worse. When aversion therapy didn't work, and it rarely did because you cannot shock or drug away someone's fundamental identity, the doctors escalated. Some victims were subjected to hormone therapy, massive doses of testosterone or other hormones intended to alter their sexual orientation. The side effects were severe: mood swings, depression, physical changes that would last the rest of their lives. And in the most extreme cases, the military doctors performed surgeries, forced surgical castrations, forced gender reassignment surgeries. Let that sink in for a moment. Military doctors, operating in military hospitals, with military authorization, performed irreversible surgical procedures on young soldiers without their informed consent, often under coercion or outright force. Young gay men were castrated. Young lesbian women were given gender reassignment surgeries against their will, the logic being that if they were attracted to women, the doctors would simply turn them into men. Problem solved, in their twisted thinking. These weren't just a handful of cases. Conservative estimates suggest that between 1969 and 1987, close to 1,000 individuals were subjected to some form of conversion therapy by the SADF. Dozens, possibly hundreds, were subjected to forced surgical procedures. And throughout it all, the victims were told that this was for their own good, that they were being helped, that when it was over, they would be normal, they would be whole, they would be able to live proper lives. The reality was devastation, physical scars that would never fully heal, psychological trauma that haunted them for decades. Many victims struggled with depression, anxiety, and post-traumatic stress disorder. Suicide rates among survivors were tragically high. Relationships were destroyed. Lives were shattered. And for years, almost no one knew. The military kept it quiet. The doctors who performed these procedures continued their careers. The victims, discharged back into society, were too traumatized, too ashamed, too afraid to speak out. Then apartheid fell. In 1994, South Africa held its first democratic elections. Nelson Mandela became president. The country began the long, painful process of confronting its past through the Truth and Reconciliation Commission, a court-like body tasked with investigating human rights abuses during the apartheid era. And slowly, carefully, some of the victims began to speak. Their testimonies were heartbreaking. Young men describing being strapped to tables while electrodes were attached to their bodies. Women recounting waking up from surgeries they never consented to, finding their bodies irreversibly altered. People sharing how they had lost decades of their lives to depression, substance abuse, and the feeling that they were fundamentally broken. The Truth and Reconciliation Commission heard these stories. They documented them. They acknowledged them. But justice? That was harder to come by. The doctors involved largely escaped accountability. Aubrey Levin, the man known as Dr. Shock, actually continued practicing psychiatry. He eventually emigrated to Canada, where he continued working until 2010, when he was arrested for sexually assaulting his male patients. He was convicted in 2013 and sentenced to 5 years in prison, but not for what he did in South Africa. Those crimes remained largely unpunished. Other doctors involved in the Aversion Project similarly faced little to no consequences. Some claimed they were following orders. Others denied that what they did was wrong, arguing that they were practicing accepted medicine of the time. A few simply disappeared from public view. The South African government issued apologies. In 2003, the Minister of Defense formally apologized to victims of the Aversion Project. In later years, there were calls for reparations, for compensation, for some form of material acknowledgement of the harm done. But for many victims, it was too little, too late. The damage was done. Their youth was gone. Their bodies were permanently altered. Their psychological wounds, while they could heal to some degree, would never fully close. What makes the Aversion Project particularly chilling is how it reveals the intersection of state power, prejudice, and medical authority. These weren't street thugs or random acts of violence. This was systematic, institutionalized abuse carried out by trained professionals with the backing of the government and military. It shows how easily medicine can be perverted when it serves ideology rather than healing. How doctors can become torturers when they convince themselves they're acting for a greater good. How institutions can enable and perpetuate horrific abuses when they operate in secrecy and without accountability. And it reminds us that conversion therapy, in all its forms, is not therapy at all. It's torture. Every major medical and psychological organization in the world now recognizes this. It doesn't work. It can't work. And it causes immense harm. Today, South Africa has one of the most progressive constitutions in the world regarding LGBTQ+ rights. Same-sex marriage has been legal since 2006. Discrimination based on sexual orientation is constitutionally prohibited. The country that once sanctioned the Aversion Project is now, on paper at least, a beacon of equality. But the legacy of the Aversion Project lingers. Survivors are now in their 60s and 70s, many still dealing with the physical and psychological aftermath of what was done to them. Some have never been able to form lasting relationships. Others struggle with their identities, their bodies, their place in the world. Organizations like the South African History Archive have worked to document these stories, to ensure they're not forgotten. Activists continue to push for full accountability and reparations. Researchers study this dark chapter to understand how such abuses happen and how to prevent them in the future. Because here's the uncomfortable truth. The impulse that drove the Aversion Project, the belief that homosexuality is a disease that needs to be cured, hasn't disappeared. Conversion therapy still exists in various forms around the world. In some countries, it's legal. In others, it's practiced underground. The methods may have changed. They might use prayer instead of electroshock, counseling instead of surgery. But the underlying logic is the same, and the harm is real. The Aversion Project stands as a warning, a reminder of what happens when prejudice is given the force of law, when medicine abandons ethics, when those in power decide that some lives are worth less than others. It's a story that should make us uncomfortable, that should make us angry. But most importantly, it's a story that should make us vigilant, because the monsters in this story weren't monsters at all. They were doctors, officers, bureaucrats, ordinary people who convinced themselves they were doing the right thing. They operated in institutions we trust, hospitals and military bases. They wore white coats and uniforms, symbols of authority and care. And that's perhaps the most terrifying thing of all. The Aversion Project happened. It was real. And the only way to ensure nothing like it ever happens again is to remember, to bear witness, and to remain forever committed to the dignity and rights of every human being, regardless of who they are or who they love. The victims of the Aversion Project can never get back what was taken from them. Their youth, their bodies, their sense of safety in the world. But we can honor their courage in speaking out. We can learn from their suffering. And we can build a world where such atrocities are not just illegal, but unthinkable. That's the least we owe them. And perhaps in some small way, it's how we ensure their pain wasn't for nothing.